Bismillah ar-Rahman ar-Rahim. This is the second lecture of breast cancer. I will talk now about pathophysiology of breast cancer. Breast cancer develops due to DNA damage and genetic mutation that can be influenced by exposure to estrogen. Sometimes there will be an inheritance of DNA defects or precancerous like BRCA1 and BRCA2 genes. The question now, what are BRCA1 and BRCA2 genes? BRCA1 is breast cancer gene 1 and BRCA2 is breast cancer gene 2 are genes that produce proteins that help repair damaged DNA. Everyone has two copies of each genes. One copy inherited from each parent. Does the family history of ovarian or breast cancer increases the risk for breast cancer development? In a normal individual, the immune system attacks cells with abnormal DNA or abnormal growth. This fails in those with breast cancer disease, leading to tumor growth and spread. We are seeing here in this slide breast cancer risk family history patterns that raise red flags. The first one is more than one relative with the same type of cancer. We are seeing here family member with multiple cancers. But we are seeing here family member with cancer atypical for their sex. And we are seeing here cancer in both of one organ. The question now, what are the breast cancer symptoms? The condition can affect your breasts in a different ways. Some breast cancer symptoms are very distinctive. Others may simply seem like areas of your breast that look very different from any other area. We are seeing here in this slide rare symptoms of breast cancer. In the first one, we are seeing here skin dimpling that begins to resemble an orange bell. And we are seeing here case of breast puckering. And we are seeing here case of swelling, redness or darkening of the breast. And we are seeing here case of rapid changes in breast shape and size. And we are seeing here case of itchy scaly rash on the nipple. And we are seeing here case of pain in the breast post-menopause. In this slide, we are seeing here many symptoms and signs of breast cancer. For example, constant breast or nipple pain. Nipple is inverted or turning inward. Rash or color on skin around nipple. Change in size or shape of breast. Dimpling or change in skin texture. Lump or thickening in the breast or underarm. swelling of all or part of a breast area, unusual discharge from nipple. Breast cancer may not cause noticeable symptoms either, but when it does, symptoms may include a change in the size, shape, or contour of your breast, a change in the size or contours of your breast, a mass or lump which may feel as small as a pea. In this slide, we are seeing here many signs and symptoms of breast cancer. Most common, lump or thickening in the breast, often painless. Discharge or bleeding of the nipple. A change in size or contours of breast. Redness or pitting of skin over the breast, like the skin of an orange. A change in color or appearance of areola. A change in the look or feel of your skin on your breast or nipple. Your skin may look dimpled, puckered, scaly, or inflamed. It may look red, purple, or darker than other parts of your breast. I will follow up the symptoms of breast cancer. A lump or thickening in or near your breast or in your underarm that persists through your menstrual cycle. A marble-like hardened area under your breast. A blood-stained or clear fluid discharge from your nipple. We are seeing here lump, hard node, or thickening inside the breast or underarm area. But we are seeing here case of multi-duct discharge. The question now, what causes breast cancer? Experts know breast cancer happens when breast cells mutate and become cancerous cells that divide and multiply to create tumors. Experts aren't sure what triggers that change. However, research shows there are several risk factors that may increase your chances of developing breast cancer. These include age, being 55 years old or older. The second cause is sex. Women and people assigned female at birth are much more likely to develop the condition than men and people assigned male at birth. The third cause of breast cancer is family history. If your parents siblings, children, or other close relatives have a breast cancer, you are at risk of developing the disease. The fourth cause of breast cancer is genetics. Up to 15% of people with breast cancer develop the disease because they inherited genetic mutations. The most common genetic mutations involve the BRCA1 and BRCA2 genes. The fifth cause of breast cancer is smoking. Tobacco use has been linked to many different types of cancer, including breast cancer. We are seeing here in this slide smoking and breast cancer. Scientific data also suggests avoiding second-hand smoke. Certain women may be more vulnerable based on their genes. Chronic heavy smoking is linked to a higher risk of breast cancer. Women who smoke before their first full-term pregnancy may be at the highest risk. The sixth cause of breast cancer is drinking beverages containing alcohol. Research shows that drinking beverages containing alcohol may increase breast cancer risk. The seventh cause of breast cancer is having obesity. The eighth cause of breast cancer is radiation exposure. If you have had prior radiation therapy, especially to your head, neck, or chest, you are more likely to develop breast cancer. The ninth cause of breast cancer is hormone replacement therapy. People who use hormone replacement therapy have a higher risk of being diagnosed with the condition. The question now, what are the complications of breast cancer? The most significant complication is metastatic breast cancer. Breast cancer that spread to other areas of your body, including your brain, bones, liver, lungs. Studies show about 1 in 3 women and people assigned female at birth who have early stage cancer later develop metastatic breast cancer. Now I will talk about diagnosis and tests for breast cancer. Self-exam is the first one. Physical examination or order mammogram to check for signs of breast cancer. But they do the following tests to diagnose the disease. The first one is a breast ultrasound. The second one is breast magnetic resonance imaging scan or MRI. We are seeing here case of invasive breast carcinoma in MRI scan. Breast biopsy. Immunohistochemistry test to check for hormone receptors. Genetic tests to identify mutations that cause breast cancer. We are seeing here in this slide immunohistochemistry test to check for hormone receptors, for example, estrogen and progesterone receptors. I will talk now about differential diagnosis. Breast abscess, fat necrosis, fibroadenoma. In the end of this lecture, thank you for all.